So picture this. Have you ever caught yourself holding a prescription bottle, way out at arm's length, just squinting, trying to decode that tiny smudge print in a dimly lit room? Yeah, it's an incredibly frustrating experience, right? But here's the thing. For millions of older adults, this isn't just some minor annoyance. It is a daily, invisible logistical hurdle that literally stands between them and their health. Today, we're taking a closer look at these invisible logistics of aging and how our changing senses secretly rewrite the rules of staying healthy.
Welcome to This Explainer. Today, we're diving headfirst into senior health logistics, specifically focusing on the critical intersection of medication safety and vision loss. We are going to take the standard health guidance from top organizations and look at it through a purely practical, operational lens. Whether you're managing your own health or acting as a caregiver for a loved one, our goal today is to give you clear, actionable insights that you can use immediately.
Okay, let's dive into this roadmap. We'll be looking at navigating senior health challenges, 5 medication safety tips, aging eyes and vision loss, and finally, low vision rehabilitation strategies. Let's get right into it.
Section 1. Navigating senior health challenges, the hidden logistics of getting older.
Which brings us to Section 2, 5 medication safety tips, official FDA guidance for older adults.
All right, tip number 1, keep an active medication list. Now, I know that sounds super basic, but studies actually show that a massive percentage of seniors are taking 5 or more prescriptions every single day. Let's be real. Relying on just your memory when you're managing that kind of complex chemical matrix, that is a recipe for disaster. Having everything written down on a single updated piece of paper, and yes, that includes every single over-the-counter drug, vitamin, and dietary supplement, is absolutely critical.
Moving on to tip 2, take medications exactly as prescribed. You see, as we age, our metabolic rate actually changes. That means a skip dose, or worse, a double dose, hits the system so much harder than it did, say, 20 years ago. The FDA stresses that if a medication routine is just getting too complicated or if it's causing weird side effects, you shouldn't just silently stop taking it. No, you absolutely need to communicate with your healthcare provider to find a safer solution.
Okay, tip number 3, schedule a regular medication review. Because let's face it, over time, your health changes. Those pills that were absolutely necessary 5 years ago, well, they might be totally redundant now, or they might even interact poorly with a brand new prescription. A yearly review with your doctor or pharmacist really helps weed out the unnecessary stuff, keeping your chemical baseline as clean and efficient as possible.
This brings us to tip 4, be aware of interactions. Honestly, it's kind of fascinating how everyday foods can suddenly become variables. For instance, the FDA points out that something as innocent as your morning glass of grapefruit juice, literally just juice, can dangerously alter how certain blood pressure or cholesterol medicines work in your body. No way, right? You really have to act as the CEO of your own health here, constantly asking your pharmacist, hey, will this new prescription clash with my daily routine? And finally, tip 5, safely store and dispose of your medications. Here's a quick reality check. Bathrooms are actually terrible places to keep medicine. The heat and the humidity from your shower literally degrade the drugs. You definitely want to keep them in a cool, dry place instead. And just as importantly, if you have expired medications or pills you just don't take anymore, get rid of them safely so they don't cause any dangerous confusion down the line.
So let's see how this builds into our next major challenge. We've got managing complex health needs on one side, right, versus navigating physical sensory changes on the other. Think back to that tiny font on the pill bottle we talked about earlier. You can have the most beautifully organized medication list in the world, and you can follow those 5 FDA tips perfectly. But what happens if your eyesight is failing? It's pretty much impossible to safely adhere to a complex medical routine if you physically cannot read the instructions. This sensory gap, it completely undermines the whole operation.
Now, what's really interesting about this slide is how it leads us into Section 3, aging eyes and vision loss, official NIA guidance.
So the National Institute on Aging highlights a really crucial definition here, low vision. Now, to be clear, we are not just talking about needing a stronger pair of over-the-counter reading glasses from the corner pharmacy. Low vision is a specific clinical level of vision loss that cannot, I repeat, cannot be corrected by ordinary glasses, contact lenses, medication, or even surgery. When you hit this clinical threshold, it fundamentally alters your daily life. It is a permanent change in exactly how you interact with your physical environment.
And the impacts are incredibly specific when it comes to keeping on top of your health. The NIO notes that older adults with low vision face severe difficulty reading prescription labels, which, as we just saw, directly sabotages those FDA medication tips. They also experience trouble navigating dimly lit rooms and have a really increased sensitivity to glare. I mean, just imagine trying to sort a weekly pillbox on a shiny kitchen counter with the morning sun blazing in. The glare makes it literally impossible. These aren't just minor inconveniences, folks. They are direct threats to daily health logistics and safety.
Which brings us to the solutions in Section 4, Low Vision Rehabilitation Strategies, Official AAO Solutions. And this brilliantly illustrates the path forward. The American Academy of Ophthalmology provides 3 incredible tools to bridge this sensory gap. First up on the list, optical magnifiers. And hey, these are not your grandfather's old magnifying glasses. We're talking about specialized, often illuminated devices designed specifically for deciphering that tiny font or medication bottles. Next, we have non-optical aids. Basically, this means modifying your environment. Think of things like using high-contrast tape on your stairs or installing specialized task lighting in the bathroom to create a much safer space. And finally, vision rehabilitation. This is actual clinical training with a specialist who teaches you entirely new techniques, like how to use your peripheral vision to really maximize whatever eyesight you have left. It's a real game changer.
When you combine those FDA medication safety protocols with the AAO's low vision strategies, you achieve something truly remarkable, unlocking a higher quality of life. Because at the end of the day, this guidance isn't just about avoiding terrible mistakes like taking the wrong pill. It's deeply empowering. It's about actively setting up a home environment where a senior doesn't just survive, but where they absolutely thrive safely, maintaining their independence and their dignity for as long as humanly possible.
So, as we wrap up this explainer, I want to leave you with a thought to really chew on today. Look around your own space, or the space of a loved one you care for, and ask yourself this: how will you adapt your home today to protect your health tomorrow? The tools are out there, the official guidance is crystal clear, and the power to optimize these health logistics is entirely in your hands. Thank you so much for joining me to explore this absolutely vital topic. Take action, stay organized, and keep learning.